Hi, good morning. My name is Virginia. I'm going to be your nurse today. I'm just going to go over some information that you need to know while you're going through your pregnancy. So just some things to avoid: medications, food, um, substances like alcohol, tobacco, certain environmental exposures that you should avoid while you're pregnant, travel precautions that you should take, dental care, stuff like that. I'm gonna go into a little bit more detail, okay? If I'm going too fast at any point, just let me know and I'll, slow down and answer any questions you might have. So to get started, I'm gonna go over the foods that you should avoid during your pregnancy. So these foods can cause a developmental um, risk to your fetus. It could, increase the chances of bacteria, parasites, toxins, things like that. So you want to avoid these foods. So this would be like raw, undercooked seafood, eggs, meat. This will put you at risk for salmonella, listeria, and this could cause a miscarriage or, really severe illness to the baby. You want to avoid unpasteurized dairy products and soft cheeses, which can contain listeria, and it could also increase the chance of you having a miscarriage, also stillbirth, or a neonatal infection. You want to avoid fish that are high in mercury. This would include shark, swordfish, king mackerel. These are high in mercury and they could cause harm to your sorry, cause fetal brain um harm and injury to the nervous system development. You also want to avoid deli meats like hot dogs, unless you heat them before you eat, because this could be a risk of listeria contamination. You want to avoid raw sprouts because this could have E. coli or salmonella. You want to limit your caffeine intake. If you are a big coffee drinker, you want to limit it to 2 to 300 milligrams a day, as high intake has been associated with low birth weight and miscarriage. You also want to avoid certain herbal teas and supplements, because this can cause uterine contractions. Okay, do you have any questions about that so far? No? Okay. So I'm gonna go over the counter medication that you want to avoid during pregnancy. Um, you are able, or it is considered safe to take Tylenol for pain or fever. Prenatal vitamins with folic acid and iron. These are essential for fetal neural tube and blood health. You can take fiber supplements, which can relieve constipation. Antacids are also safe for heartburn. Now, medications that you should avoid would include ibuprofen, things like naproxen. This can cause um, this can cause fetal heart, kidney, and amniotic fluid. Um, I'm sorry, it can affect the fetal heart, kidneys, and amniotic fluid, especially in the third trimester. You want to avoid aspirin unless it is prescribed by your doctor because this could increase the risk of bleeding. Um, Certain cold and allergy medications like decongestants can reduce placental flow, especially in your first trimester. You also want to avoid high doses of vitamin A supplements because this can cause a risk of birth defects. Um, Now, environmental exposures that you want to avoid during pregnancy. You want to avoid exposure to old paint, contaminated water, contaminated soil, as this can cause fetal neurodevelopment delays and low birth weight to the baby. You want to avoid pesticides, herbicides. This is also linked to birth defects and miscarriage. Um, Radiation or X-ray exposure, especially high doses in early pregnancy, can cause fetal harm and development. Can harm fetal growth and development. Sorry. Um, you want to use protective shielding if essential imaging is needed, like if you need dental, some type of dental work. You definitely want to inform your dental provider that you are pregnant, so that they can take the necessary precautions to protect you and the baby. Now, as far as alcohol, tobacco, and substances that you should avoid during pregnancy, this would include, um, you want to you want to eliminate any alcohol because no amount is safe during pregnancy. This can cause fetal alcohol spectrum disorder, and it will reduce or restrict growth. It can cause facial abnormalities and neurodevelopment issues as well in your baby. You want to avoid nicotine and other chemical substances. This can cause low birth weight, premature birth, placental issues, and sudden infant death syndrome known as SIDS. You want to avoid illicit substances like cocaine, meth, opioids. This can cause permanent premature birth, low birth weight, neonatal absences syndrome, and congenital abnormalities. Do you have any questions so far? I know this is a lot of information that I'm going over. And like I said, if you want me to repeat anything, you want to get clarification on anything, let me know and I will answer your questions as best as I can. Okay. Um, Now, if you don't have any questions, let's finish this up. I'm going to go into travel precautions that you want to take during your pregnancy. So during your second trimester, which is 14 to 28 weeks, um, you may experience morning sickness, but it does improve. Um, Sorry, it does improve over time. Now you want to avoid areas that have Zika, malaria, or other infectious disease outbreaks. You want to avoid regions without reliable medical care. You want to avoid long distance travel if experiencing high risk pregnancy complications. Um, and you also want to avoid prolonged sitting, as this can increase the risk of blood clots. Preventative measures that you can take is you want to walk, you want to stretch every 1 to 2 hours. You can wear compression stockings, which you can, easily get online nowadays, or, pharmacies like CVS or Walgreens, places like that. You also want to avoid crossing your legs for long periods of time because this can also increase the risk of blood clots during pregnancy, okay? Um, as far as dental care, during your second trimester, you want to keep up with your dental care. Dental procedures, um, routine dental work is considered safe, but you want to avoid electrical procedures in the first trimester. As far as dental x-rays, you want to use abdominal shielding if necessary, but generally you want to avoid unless it's urgent for you to complete those x-rays. If you have dental issues like gingivitis, periodontal disease, tooth decay, um, these are common dental issues that you may um, deal with during your pregnancy. But again, as long as you take the necessary precautions, just this is information that we want you to be aware of, so that your baby is healthy, you're safe, baby safe. So, again, these are just guidelines that we want you to be aware of, okay? If you have any questions, if any questions come up after you leave the office, you can go ahead and give us a call. I or someone else in the office will get back to you to answer your questions, okay? All right, well, I hope you have a good day, okay?